Okay, I think it's time to start our webinar. Thanks to all of you who have taken the effort to join us here today. My name is Katrin Schiffer. I'm the Executive Director of Correlation European Harm Reduction Network, and also was one of the organizers, co-organizers of the Manifesto and also this event. It's really my privilege to extend a warm welcome to each of you, marking the launch of the 2024 Manifesto for Progressive EU Drug Policy. Before I tell a bit more about the background, a few housekeeping remarks. This is set up as a webinar, meaning that you cannot raise your hand and speak on directly. We will look into how far we come. We only have a 1-hour meeting. If we still have time for discussion afterwards, we will see that we can provide you with room for questions and answers. And otherwise, I would really like to ask you, please use the question and answer section and also the chat if you have comments or remarks. We have an esteemed panel of experts today who will reflect on different aspects of the manifesto. This includes members of the European Parliament and also representative of the Euro Input, the European Network of People Who Use Drugs. We will go to them in a few minutes, but I think it would be nice to provide you as well with a very short background on the manifesto. Early this year, we came together with a few drug policy experts from IDPC, NEWNet, UNITE, and Correlation European Harm Reduction Network to discuss the formulation and promotion of a drug policy manifesto. We organized different consultation with quite a big group of civil society organizations. I think we collected a group of nearly 30 organizations. We organized calls, we collected their input. They also participated and provided input to the draft strategy, to the draft manifesto. And we also asked them to become involved when it comes to the promotion of the manifesto, because this is actually where we see this is the main work of the manifesto. It's not done by writing a nice manifesto, which looks good, but we need to get it out there and we need to get it signed by people, and we also want to have it an impact. So our local partners did a lot of work, amazing work, reached out to their MEPs in their country, to other national policymakers. And if you look to the current list, I think we have nearly 600 signatories, including 25 policy and decision makers and approximately 300 civil society organizations and 275 drug policy experts. That's quite something, I would say, and we are extremely happy, not especially for the support from the MEPs and the policymakers and politicians, because this is where we want to create impact. Shortly about, now you know who we are, why we did the manifesto and what was the reason. We are deeply concerned about the developments of the EU drug policy. Despite the EU drug strategy, which goes from 2021 till 2027, promotes a relatively balanced drug policy approach, we have observed a troubling pivot towards punitive war on drugs rhetoric and policies at EU level. People who use drugs are increasingly stigmatized and labeled as criminals and being associated with organized crime. While massive investments are being made in the field of drug supply reduction and crime prevention, often bereft of evidence, we've witnessed a distressing decline in harm reduction services founded upon evidence-based principles and yielding positive health and societal income. And this is also reflected in the current EU drug policy program. There is no funding mechanism for drug demand reduction and harm reduction in particular, which also means that the implementation of the EU drug strategy is currently not implemented in a balanced way. We see the upcoming EU Parliament election as a unique opportunity to amplify our manifesto and to rally support from supportive MEPs and also other policymakers and politicians and civil society. Just to recall again what we were asking for, we asked for an increased investment in health, social care and harm reduction. We want to abandon the war on drugs policies and narratives. We want to ensure meaningful engagement of civil society and communities in drug policy formulation and implementation. And we want that we explore innovative approaches, including responsible regulatory models. So I think this gives you a short overview on what the manifesto is about, and I now would like to move forward to one of our first speakers. I think it was planned that Isabel Santos should be presenting, but she's not yet here, right? So I'm giving the word to Alexei Lakhov. He is the Executive Director of the European Network of People Who Use Drugs, and he has extensive experience in developing and implementing interventions, and we are happy he's here to reflect on the manifesto from the perspectives of people who use drugs. The floor is yours, Alexei.
Thank you, dear Katrin. Thank you for the introduction and for inviting us to participate in this important webinar. I would like to extend my gratitude to our esteemed colleagues and partners from UNITE, Correlation, the International Drug Policy Consortium, and the Nightlife Empowerment and Wellbeing Network for your invitation to speak at this webinar and for your tireless efforts in shaping the 2024 Manifesto for a Progressive EU Drug Policy. This manifesto rests on several crucial pillars: increasing investment in health and social care, discarding outdated war on drugs strategies, promoting civil society and community involvement, and exploring innovative approaches, including responsible regulation. While strides have been made, both long-standing and emerging challenges threaten our progress. The European Monitoring Center for Drugs and Drug Addiction warns of a growing diversity in substances across European drug markets, placing people who use drugs at heightened risk of adverse health effects, including overdoses and fatalities. We mourn the loss of our peers to toxic drug supplies, including those related to the emergence of xylazine and nitazines lately. Harm reduction strategies, notably sterile injecting and smoking equipment provision, as well as opioid agonist treatment, are vital in curbing HIV and HCV transmission among people who use drugs. Yet, access and adherence to these services remain inadequate in many countries. The chronic underfunding of the United Nations Programme on HIV/AIDS, UNAIDS, exacerbates these issues. In recent years, as our colleagues from Correlation have outlined in their reports, young drug users under 18 years of age, people in prisons, people engaged in camp sex, and undocumented migrants have faced significant barriers to access to harm reduction services. Funding shortages and punitive laws impede our outreach efforts, with service provision notably declining for sex workers, people experiencing homelessness, and women who use drugs. Yet, despite these challenges, Europe witnesses a shift towards pragmatic drug policy reform. Initiatives on medicinal cannabis, legal regulation of adult cannabis use, psychedelic therapy, and innovations in harm reduction, such as drug consumption rooms, drug checking, and heroin-assisted treatments, demonstrate a growing embrace of evidence-based approaches. Let us not impede this progress by succumbing to the sweet talks of the far-right and anti-rights movements. What remains paramount in our call for drug law reform is decriminalization, offering a pathway to end human rights abuses and racial injustices inherent in drug control. EUR advocates for the legal, regulated control and safe supply of the mind-altering substances, recognizing that this journey towards a more humane drug policy will unfold gradually. In closing, I urge the European Parliament to heed the call for progressive drug policy reform outlined in the 2024 Manifesto. Together, let us forge a future where compassion, science, and human rights guide our approach to drug policy in Europe. Thank you very much.
Thank you very much, Alexei, for this very comprehensive feedback and reflection. I'm a bit I have a question to the supporting team, because I know that Isabel Santos is not here yet. Is there any advice or who the next speaker could be? Okay, I see it. Okay, so I suggest we first go to Janka. Janka is led the expert team on addiction behavior and has been member of the Czech Government's Council for the Coordination of Addiction Policy since 2022. So I'm very happy to have Janka with us, and after that we will give the floor to Sven Clement. Janka, the floor is yours.
Okay, can you hear me? I'm sorry. Okay. Hello, my name is Janka. I'm from the Czech Pirate Party, which has been fighting for rational regulation of psychoactive substances since 2013. Since then, I was a member of this party, and we've been hello. We've been trying to get more funding to the services, to the NGOs that are trying to make the lives of people using drugs better, and we are trying also to change the regulation on the national level. Since we joined the European Parliament 5 years ago already, we tried to do the same on a European level, even though, as you may imagine, with 3 people in the European Parliament, it's not easy to do anything substantial, but we tried to form a group that was supposed to work on regulation of cannabis on European level, because we have a strong connection with like-minded countries, for example, Luxembourg, Malta, Germany, Netherlands, and we are trying to coordinate in the context of regulation, because in the end, we are all in this together, at least in the context of European law, which is also very prohibitive of any change that would compromise the status quo of international conventions. So it is our duty to coordinate between each other and to try to change European regulations to allow rational regulation and to allow the scientific and medicinal use of psychoactive substances with great potential. This year we have European elections. I don't know if any of you have had the chance to look at the program of the European Pirate Party, but we have a common program for our party, which is revolving around drug addictions and addictions in general, because when we deal with addictions, we also deal with non-substance addictions, and we try to take it holistically, because it all resolves around the problems with mental health and people trying to escape from the reality of not enough mental health care by themselves with the use of some substances or gambling or social interactions, which can be pathological too. So we have this program. If you want to look at it, it's on the website of the European Pirate Party, and all the pirate parties in the European Union are binded by this program to the European elections. So that means that if we get some European members of the parliament, please don't hesitate to contact them and want from them to do what the program says, and I'm sure they will be happy to be of service to anyone who is also trying to get to more harm reduction focused regulation on the European level. I hope I wasn't too long. Maybe that's enough from me. Thank you very much for inviting me to speak, and I'm very happy to work with all of you in the future.
Thank you so much for being here, and also making very clear that you are open to support us also in the future, because I think this is clear to us. It's not done once we have once the elections are done and that we say, okay, we have done our work. But I would say this is something where we should start really doing our work. And it's great to have an ally in a party in the parliament which is already telling us that they are willing to support. So you can definitely count on our on the fact that we will reach out to you. Thanks a lot. So the next speaker would be Sven Clement. Sven, we will share all the different CVs in the chat. So I would like to give you the word and share what you think. Sven is from Luxembourg, and he's also part of the Pirate Party. So Sven.
Yeah, good afternoon. This becomes a meet and greet of pirates, apparently. Jokes aside, I'm a very late addition to the program. I think I've got invited 30 minutes ago to speak to replace somebody else. So bear with me if I'm improvising a bit, and especially given that Janka already spoke about the Common European Election Program, I'll focus more on the national MP side. I'm not running for any office at the moment. I'm very happy to be an MP, recently re-elected in October, so I have a 5-year term, and I'm a bit less concerned by the elections. So I was very happy to be supporting the manifesto very early on and share that with the network. Being a member of Unite definitely helped and shows the commitment that is needed for national legislators as well as European legislators to engage in a common European drug policy. If there's one thing we learned in Luxembourg when we worked on harm reduction and on legalization and on drug policy measures, is very quickly, especially as a small country, you need at least the acceptance of your neighboring countries. To give you a very pragmatic example, is we legalized medical marijuana use already a few years back, and the biggest issue was what is happening to cross-border workers. We can legislate on our national territory quite easily, but we can't legislate across the borders. And that's where the European Parliament comes in. That's where the European co-legislators come in. That's where we need, as national parliaments, to work together with our European colleagues. Because in the end, it doesn't help if one country is very progressive in drug policies when the neighbors are doing exactly the opposite. So it's very important as when you're looking at policy that we make sure that it translates across borders in Europe, that we don't discriminate people even more so than they are already discriminated on just because they live on the wrong side of the border or because they work in another country that they are living in. And we too often see those issues playing out in Europe when it comes to drugs, even more so because many countries are still in a repressive phase and not in a decriminalizing mood. And I'm very sad to report that the current or the new Luxembourg government is certainly less pragmatic or less progressive when it comes to drug policies. So there again, as a national legislator, it really helps to network on the European scale to bring back best practices and show to our national parliament, to the parties that currently form the majority, how we can do it in a better way, in a more pragmatic, in a more progressive way. How can we ramp up investment into health and social care? How can we make sure that those investments are not simply money that we spend, but are actual investments in the future? How can we use public money as an investment to get to a world where we discriminate less and where we help those that are in need of help? Janka spoke about addiction as a 360-degree view. It's not only about drugs. Addiction has many facets and we need to address all of them. And we need to be accepting of all of those forms of addiction. How can we, if we are accepting, abandon that old war on drugs? We go to war, we build an army, we send police helicopters after small-scale drug dealers. Honestly, that's not an investment, that's just wasteful spending, because it helps nobody getting to a place where they feel comfortable. It just fills up jail cells. So essentially, what we need to do is also look at how can we cooperate across borders to not criminalize a person on one side of the border while we are accepting on the other side of the border. And all of that needs to be bottom up. And that's where the national perspective comes back into play. To give you an example, again, from the when we decriminalize or legalize, or however you want to call it, that light legalization of cannabis that happened in Luxembourg and in Germany. So we all agreed, both countries agreed finally on 3 plants. But in Luxembourg, you are not allowed to transport any product, not even from your home to your holiday home. Whereas in Germany, you are allowed to keep on the person a certain amount. Then we have the whole question of, and I agree with the chat that there are huge differences between legalization, decriminalization, depenalization. I could go into a whole rant on why that is important that we go further and are more progressive, but sadly we don't have time for that. But it shows that even if you have a progressive policy or are a bit more progressive than the past, we quickly have those national borders again in the debate. And that's why it's important that we work all together. And that's why I'm very happy to being able to speak to you today. And I hope for a very engaging discussion later on. Thank you.
Thank you so much, Sven. This was really great to hear from you. I totally agree. There is a large range of different policy options. And I think the point also in the manifesto is that you want to be short and you cannot be too long focused on all the different elements. And I also heard there is a comment in the chat about the recent, the need to focus more on human rights. I totally agree. It would be good to focus more on these elements, but we, in one way or the other, we had to limit our number of words to make it more impactful in the very end, so to be as short as possible. But the point is more that I think the manifesto is also a way to address different elements, for example, also at local or national policy or European policy, what you think would make sense. So I would also invite everyone to use the manifesto more as a kind of inspiration and supporting document to push for very specific asks you might have. I see that as I see, there is no Isabel around at the moment, I guess. Or do I miss something? No?
So Isabel Santos unfortunately couldn't join us, but Beatrix Vaz from NEWNet is going to read her statement. So we really apologize. She hasn't been able to make it onto the webinar.
Okay, so Trixie, you will read the statement, or?
Yes, I can read the statement from Mrs. Isabel Santos.
Great.
Thank you. Allow me to start by thanking NEWNet for the kind invitation to address you on this occasion and to salute Correlation, IDPC, and the NEWNet for this very significant goal of joining efforts to advance towards a more comprehensive and humane approach to EU drug policy. The launch of the manifesto we mark today comes at a time in which the EU drug policy is at a crossroads. This critical turning point will have on a new European Parliament, a new European Drugs Agency, and a new European Commission, its main protagonists, but will be played under the potentially increasing repressive and securitized logic emerging from Brussels, coupled with the threat of the expansion of far-right political influence across Europe. It is therefore high time to employ efforts in trying to change the paradigm, and this manifesto constitutes an extremely constructive and useful avenue for such change. The war on drugs has never made any winners. On the contrary, such punitive and enforcement-led approaches only came at great economic, human, and environmental cost. This policy choice seems difficult to justify nowadays, not only because of the poor value for money of prohibition, but also for its opportunity costs in terms of investment in health and social development. Although there is no silver bullet that will solve every issue, evidence shows that some solutions are more efficient than others. In this regard, I am obliged to recall the extraordinary example of my country, Portugal, which in 2001 implemented a series of policies aimed at prioritizing public health and harm reduction. The possession of small quantities of drugs for personal use was, back then, decriminalized and replaced by a system of fines and offers of treatment, while harm reduction measures were put into place. The result was a dramatic drop in drug-related deaths and overall drug use when compared to the terrible situation lived in the late 90s. Although we are all aware that drug-related challenges are nowadays increasingly diverse and complex, demanding integrated, balanced, and multidisciplinary approaches, one thing appears to be clear. The approach is setting security and health on an equal footing and placing prevention, treatment, care, harm reduction, and social reintegration at the same level, as it was the case in Portugal 25 years ago, are the driving force behind progress. To get there, I firmly believe that civil society's meaningful involvement is pivotal. Civil society plays a crucial role in this field, and it deserves not only our praise, but also our gratitude for its relentless efforts in pushing throughout the years for a more evidence-based, equitable, and human rights-based approach to EU drug policy. That is the reason why one of my priorities since the moment of my designation as European Parliament rapporteur for this file was to meaningfully involve civil society in the process and to listen to its perspectives and concerns through an open and frank dialogue. Its impact and outreach will now be extended to the work of the EU Drugs Agency, where it will have a privileged arena for action. The involvement of civil society is thoroughly ensured through numerous provisions throughout the agency's regulation, in contributing to the collection and dissemination of information and data, in monitoring the drugs phenomenon and sharing best practices, or in participating in the European Drug Alert System. However, the core of this cooperation is to be found in Article 55 that draws the lines in which it shall be maintained. After countless versions and few commitments in exchange, I am glad that we landed a strong and ambitious wording for this article. According to its final redaction and as per our intention, a cooperation for the purposes of consultation, the exchange of information, and the pooling of knowledge shall be maintained between the organizations and the designated single contact point under the authority of the executive director. While being sufficiently open and flexible in finding the most convenient avenues for such cooperation to take place, the letter of the law is, however, enough strict in ensuring that this is to be effective. This is precisely the point in which civil society contribute the more and the better. Although this is meant to be a two-way process, I believe that a significant part of the activities will be animated upon the civil society's initiative that receives here devoted space for its voice to be heard. Whether it is about representing the diverse perspectives and empowering the voices of the affected communities, communicating relevant research, data, or information on emerging challenges and trends, or upholding human rights and social justice, by prioritizing harm reduction and treatment over punishment or enforcement only view of the drugs phenomenon, this is the place to do it. Although the devil will be in the details, I am very optimistic and deeply convinced that the strengthened cooperation with civil society within this reinforced mandate will allow us to progress in an intelligent and pragmatic manner, knowing that on this path, it is not enough to just do well. It is necessary to always do better and constantly innovate. Only in this way will we be able to rise to the challenges and effectively accompany change. Thank you very much for Mrs. Isabel Santos for this statement.
Yeah, thank you, Trixie, on behalf of Isabel. Thanks for this very good statement. The nice thing is that we do have time for questions and remarks, and I could imagine, Trixie, I think it is possible to put up a hand and also speak, right? Yeah. So if you would like to share a question, to ask a question, to share something, a comment, reflect on the manifesto, talk about potential follow-up activities, what you think is important, we would really very much welcome that. I see Giuliano Gavazzi has raised his hand. Can we enable them to speak? Yeah.
Giuliano, you should be able to.
Okay, fantastic. Here am I. Hello, everybody. I'm Giuliano. Probably I met some of you at CND 67. My main concern is that we are still we're continuing reinforcing the misunderstanding that people who use drugs are a category. And I don't think this is the case. I think what we should do is actually pretend that our rights are acknowledged, that we are simply people. And I'm not talking just about myself, of course, I'm talking more about those who are discriminated because of the fact that they are marginalized for other reasons. So until we are concentrate on the usage of drugs as if it was a problem, we are justifying what the prohibition has done so far. That is to victimize a category of people that are really just marginalized for other reasons. You know perfectly that a lot of powerful people use drugs, but they don't suffer for it. So this is my point, that we should in a way try not to use words that keep on enforcing this idea. If that is clear what I said, I hope.
Thanks, Giuliano. I think that's a very important one. And I mean, we see also when we talk about the narrative, how negatively impactful language can be, and how even if it's not intended, but if it's intended even more. So that's definitely something we need to keep in mind. I hear there are different things in the chat. Is it that John Peter would like to say something? Did I understood correctly?
Oh, have a look at the Q&A, Katrin. There are 3 questions there.
Ah, sorry. Yeah. Okay, Adria has a question. In recent years, we have seen how the European Commission and other actors took an increasingly securitized approach to drugs. What change of narrative do we need to see in Brussels to make sure that European drug policy priorities, health and community participation? How can we achieve that change in narrative around drugs? Is this something you, Adria, you would like to ask more in general to the speakers? Probably I can ask it to Sven and Janka if they want to say something about that. Would you be able to respond to this narrative thing, Sven?
Thank you, Katrin. I think that both questions raised by Adria are very interesting questions. The first one is the narrative. And I think it starts with the manifesto, but it can't end there. It's about building coalitions, talking to the peers in legislative chambers, and building that momentum to change how we talk about drug policies. Very often, and I see that with colleagues even from the left, but mainly from the right of the center, where as soon as you speak about drugs, it's about repression. It's about how can we fight this? And we see a very martial language being employed, very reminiscent of the Reagan era and the war on drugs. And I think we need to get back to a speech and to a vocabulary that addresses those issues. And it starts with us as multiplicators, as activists, but also as legislators with a progressive drug agenda, to talk more reasonably about those issues. And slowly but steadily that changes the discourse. It will not happen overnight. Just look at LGBTQIA+ rights and how the debate, the discourse about the issues has changed over the last years. If you look at debates 30 years ago, it was completely different. So I really think that the same strategies will apply when it comes to drug policy. The second one is obviously, I wasn't aware of the manifesto in favor of legal regulation led by the mayor of Amsterdam. So I'm very happy if Adria could send me some more details about that or post it in the chat. But I believe strongly that we only can be stronger if we are together. And it's such a platitude, but it's so true. If everybody works in their own corner doing whatever they believe important, we will not get the change we desperately need and we are seeking. So we need to work together across party lines, across country lines, and even across organizations. Because if I've learned something over the last years working with NGOs, it's that very often NGOs also have a tendency to work in their own corner, be that because of the funding, be that because of ideological differences, and very often it's about commerce or individual words that make cooperation so much more difficult. So we need to address that. And if we are working together, we can have that much stronger impact on legislative proposals and also on how we talk about it. So both questions are actually really well linked together. So thank you for those. And I hope I answered at least a bit succinctly to that. Thank you.
Thanks. Very good. Yeah, I would like to shortly follow up on this because we've been also closely linked to this initiative in Amsterdam, which was organized by the mayor of Amsterdam in January. And currently we are organizing the European Harm Reduction Conference at the end of the year in Warsaw, where also City of Amsterdam will host a satellite meeting, a follow-up on this. And what we see on one hand is that for sure we need to change and we need to address certain challenges at EU level. But if you look to the most innovation, where innovation takes place, this is at city level. This is where actually all the problems come up. This is where progressive new ideas are built up and implemented. And I think it is key to somehow cooperate more closely with cities on the one hand, but also not to lose the exchange between national drug policy and decision makers and the local level, and also the European level and local level. So this is something, it is a good question indeed. Mainline Foundations says if the manifesto will be translated in Dutch. Yeah, we haven't really done this because most of the, I know I translated it in German because I thought, okay, we thought it's really necessary for, because Germans don't speak well English. We were not sure about the Netherlands. So if you think it is something needed, reach out to us and we can think about it. Are there any other questions from which I have probably overseen or no? I just saw that someone said something that John Peter wanted to post a question about
no, that's fine actually, Katrin. He was just asking about next steps, but that's going to be the last presentation.
Okay, so this will be the last one. Yeah, okay. So is it probably then already a nice idea, Marie, to move on to the follow-up steps, which will be covered by you, and then we probably also have time for some more comments or questions on what you are telling. Thanks a lot.
Sounds good. Thank you. And thanks so much, everyone, for being here, for being so active. Please feel free to ask more questions in the Q&A or the chat. So I'll be very brief, but with the group, we wanted to finish the event with a few recommendations and calls for action, in particular for MEPs, but obviously if you have contact with your MEPs, then you can push them towards these recommendations as well. So the first recommendation is that we wanted to ask MEPs to support us in presenting the manifesto to the LIBE committee, because that's the committee that's mostly focusing on drug policy issues. And that's to give more visibility to the manifesto among MEPs who have an interest in a specific topic. The second recommendation is we wanted to call on MEPs to consider the possibility of creating an informal working group within the European Parliament that would be dedicated to drugs and drug policy discussions, which would regularly consult with civil society and communities as well. That's an idea that we've had for a very long time, but it requires leadership from MEPs to create that working group and make sure that drug policy issues remain on the agenda over and over and over again. Our third recommendation is we encourage MEPs to ensure that civil society and affected communities, including in particular people who use drugs, are invited at all drug-related hearings that are being organized at the European Parliament. Our fourth recommendation is to call on MEPs to ensure that the European Commission implements the EU drug strategy in a balanced way and hold the EU institutions accountable for the securitization of drug policy. And I know that's a question that came up earlier, and that's something that we really need to fight against. Our fifth and final recommendation is that we urge MEPs to encourage the European Commission to develop a new funding mechanism for drug policy projects that would focus on health and in particular on harm reduction, because these topics have been severely neglected over the past few years over projects that really focused almost exclusively on drug law enforcement and supply reduction. So that needs to change. As civil society, we will continue to discuss how to elevate the manifesto and foment discussions at national level, at European level. So we will share further next steps and ideas in the next few months. And we can use this, the list of people who have participated in this webinar. But if you are interested in engaging more in the discussion, do reach out to Katrin, reach out to us. And we look forward to identifying further next steps, great creative ideas And also, if you want to organize an event in your country to launch the manifesto, that's also something that you can do. So yeah, just be in touch, and hopefully we'll have more ideas in the next few months.
Thank you so much, Marie. That's very good. And it's also quite hopeful, because I think it's giving us something to work on. And not only us, but indeed also for the members of the European Parliament after the elections, that we can really focus on, because we don't want that this manifesto dies a silent death after the elections are done. I'm not sure if Sven, you would like to shortly comment on this and probably share how realistic you see these asks from our side.
Yeah, very briefly. I think that the asks are quite eloquently formulated. The question about the realism is always more difficult to address as a policymaker. Obviously, we are being inundated with requests to support all kinds of causes. And so most of us are already quite well versed in being selective on what we sign up to. Nonetheless, sometimes it's easier, and I can say that because I'm not running at the moment, it's easier to say yes to something than to say no and to have to explain why you said no. So the asks are often supported before elections, but need to be enforced after the elections. And it's where the NGOs are challenged. You guys need to keep us accountable and remind us of our promises. So whoever signed the manifesto, whoever agreed to concrete steps after the elections, should be held accountable. Call us, mail us, visit us, and if after a reasonable amount of time no action has been done, name and shame us. That's our job, to be held accountable. And it's your job as NGOs to do that, to make sure that politicians are held accountable. So it's certainly not the easiest ask, but it's certainly something that you can enforce. And if politicians are good in something, it's that we don't want our names associated with negative press. So once you got a commitment, keep us accountable. It's very difficult to lose track. It's very easy, sorry, to lose track of all the commitments we made. I'm very humble and honest on that. I know that without my team, I would probably forget 90% of what I promised during an election campaign. But that's why we have teams. That's why we have collaborators, parliamentary assistants, and those are the guys that you need to build relationships with as well. So don't stop at the politician, but try to get from every politician his assistant's phone number, because that's the guy you want to reach. That's the gal you want to talk to if you want concrete action to happen, because they normally get a hold of the politicians much easier. And I don't tell you how many emails enter our mailboxes every day. So talk also to the assistants. It's definitely helpful. And I'm sorry if that's not showing off as a politician, but I try to be realistic on what we are doing and how our lives are. They are busy, so keep us accountable, help us to deliver what we promise. Thank you very much.
Thank you, Sven. I think we are not frustrated, but very happy with your support, and I'm sure that we will come back to you and try to hold you accountable. So don't worry about that. This is a promise. This is a promise. I think we have already quite some ideas for once the Parliament is in force and what we want to achieve from there. I think the asks Marie has just provided an overview of these are asks which are not unrealistic and are not unfeasible, and especially when it comes to the formation of an informal group of MEPs and civil society focusing on drug policy. And also when it comes to the LIBE committee, I think this should be things which we should be able to achieve. And from there on we can go. And I would like to thank all the speakers, Sven and Mikuláš, and also Alexei, for being here and presenting and sharing their ideas and reflections. I would like to thank all the partners from Unite, from IDPC, from NEWNet, for being here and supporting. I hope, thanks to all the participants, I hope that you will continue sharing the manifesto. If you have any questions about how to promote it in a better way, please do not hesitate and contact us. And yeah, the only thing we can hope for is good elections in June, which bring a better parliament. And that's it from my side. I'm not sure if anyone else would like to say some other closing words from the organizers. No? Okay, then I think I would like to thank you. Thanks for everything. Bye-bye.
Thanks, everyone. Bye. Have a good day.
Bye-bye.
Thank you. Bye-bye.
Bye.